Greetings and welcome to Ask the Doc, where we are connecting with doctors throughout the community and finding out a little bit about what's happening. So today, Dr. Waqas Ahmed, who is the CEO and founder of American Telephysicians, and he's going to tell us about a wonderful web and app-based system that he has founded. Welcome.
Thank you so much.
It's good to see you.
Likewise.
2 years ago, I believe we had this interview when you were just getting started with your wonderful business, Cura for You.
That's correct.
Let's discuss a little bit about American Telephysicians, and how you've developed on from there.
Thank you so much. Let me take a step back. And people ask me this question that you have American Telephysician, you have Cura for You, and Smart Clinic, and then the NeuroX. So it's trying to understand. So I'll give you an example. When you are in the hospital, you get admitted under a primary care doctor. You get all the services right there. If you need a specialist, you will get a specialist care there. You get labs there. You get any diagnostic studies, any procedure, medication, everything there. When you get discharged from the hospital, you go home. Now the problem is for the patient, if you have to see a primary care, you have to go to the office. For specialists, you have to wait and get an appointment there. You need to go somewhere else. So I think as a patient, you basically just walk around and really sometimes you don't know where to go. So we, as an American Telephysician, a physician-led company, we have our physicians and we developed, using our IT team, developed this whole online healthcare system. And the concept is that if you're at home, we as a company bring healthcare services at your doorstep, utilizing and connecting the service providers in the community, because mostly health service is local. But key thing is also that you as a patient also know what price you're going to pay. So it's access, affordability with the price transparency, and the big focus, awareness, patient education.
My goodness. Now, you mentioned a couple of the different areas. One of the newest ones is NeuroX.
Right.
So what is NeuroX? Because that's another branch again.
So again, the same question. When you're in a hospital, you have department of cardiology, then you have a department of neurology. Similarly, American Telephysician, we have a Cura for You is our hospital system, online hospital system. And within that, we all now have started NeuroX, this online neurology and psychiatry care. And the reason we started this, because this is, focusing on the brain health. A huge population of the elderly and even young patients, if they have neurological disorders, and utilizing our network of the neurology physicians and technology, we're now basically improving the access for the brain and mental health.
Now, you touched on something there with a lot of the elderly. This is something that will be very useful for them. But also we have to remember that some of the elderly are not that technology inspired or adept. So how do we get over that? Because basically this is for apps and for webs and the computer and a smartphone.
So absolutely. So I think it's a transition phase. We are very flexible in that and understanding the limitation of the elderly. It's a threefold approach. One is those who are tech savvy enough that at least they can have a cell phone. Our technology enables them to get a link on their phone or iPad, which is very common now, just to get a consultation, right? The second is areas where senior living facilities, nursing homes. We have operations now started in the nursing homes in conjunction with the medical assistant and nursing staff there. And the third is now we're opening American Teleclinics starting from Jacksonville, where if you're not tech savvy, you can just come to the office and get, your medical assistant will help you. Only thing will be the physicians may be basically somewhere else, but they will be able to see that. This concept actually very important, especially in the rural areas where you may be able to go to your nearest primary care office, but for specialists, you don't have to travel for 2 hours because we are basically connecting our specialists with the primary care offices in those rural areas.
Oh, that makes a huge difference. So going back to NeuroX, what are the exact services that NeuroX offer?
So NeuroX, I give credit to one of our neurologist team led by our NeuroX director, Dr. Farouk, who's a stroke specialist. Is the idea is to provide all the services covered by brain health. So if you have, let's say if you're worried about your parents may get dementia, memory loss, you want to get evaluation, you're worried about mental health, anxiety, or you worry about the epilepsy, headaches, and of course some of the chronic conditions, where you need a second opinion services. We are not sure about diagnosis. We as a company, NeuroX, has all specialty covers. We have very rare specialty, even some neuro-ophthalmologists or neuro-oncologists and the neurosurgeons. And I think that's a beauty that utilizing technology platform, these physicians may not, we have physicians across the US, and now they're seeing patients across the globe.
Yes.
I think this is just mind-blowing and amazing concept.
Now, do you only have access if you're a patient? For instance, my parents are no longer, but if I had to contact someone for my parents, is it possible for me to use the system for them?
Absolutely. It's actually more, especially for NeuroX, that's the way it is. And my journey when I started this one, I wanted to help, my parents who live in other country, right, in Pakistan. Yes. And this was exactly the same, that if you're living in another state or not nearby, but you can actually not only call, but you also go online on NeuroX, make an appointment for your loved one, your parents or whoever, and you actually be part during that conversation, a video call. You can join as a family member there, and you exactly talk to the doctor. You know what the plan is. Then you go on Cura for You. You schedule their other appointments, labs, radiology, if they need a cardiology or they need a nephrology. So the idea is that you're not just, find one specialty, you find all these specialty services at one stop.
Wonderful. Now, there's something quite unique that's been happening with you recently, and that's the United Nations. Would you like to tell me a little bit about that?
This it's a teamwork, and we were first invited by United Nations in 2019 when we presented our Shifa for You project in Pakistan. And of course, then we in 2020, brought this project in the US, and we're working with many organizations, some of them. And during this COVID, we also helped enable many charity organized clinics to remain open by providing our smart lane technology. And very excited that now this month we are hosting an event on digital health as a stakeholder. Of course, and thanks to our partners and Blue Ridge Consulting. And then we're also working with officials from U.S. Army, officials who are working closely with NASA, AARP. So it is obviously very humbling, and whole team is very excited about that.
Wonderful. Thank you for coming in to tell us about this. And I am sure that we'll be getting updates on a regular basis.
Thank you so much.
And so if you'd like any more information about the American Telephysicians or Cura for You or NeuroX, then you need to go to iwannabuzz.com.